The Food and Drug Administration on Wednesday approved the first treatment that genetically engineers patients' own blood cells into an army to seek and destroy childhood leukemia, a major development in the medical world. And joining us is Dr. Katharina Elliott, medical director from Bronson Pediatric, Hematology, and Oncology, to share her thoughts on this. Dr. Elliott, good morning.
Good morning.
Thank you so much for taking time to join us this morning. As far as what you understand about this, what does this all mean? What does this look like as far as a breakthrough possibly in cancer treatment?
Well, the therapy that you're talking about is named CARTY therapy, and it's really going to, I think, revolutionize the way we treat leukemia in children, and hopefully will lead to greater use to help adults as well in the years to come. But leukemia is currently the most common type of cancer that children have, and although we've made some serious progress in curing most of the patients, there's still about 15% that has a disease that doesn't respond to the treatments that we've had until now. And before this therapy was developed, we often were faced with a very difficult discussion of telling a family that we no longer had anything that could cure them. But this therapy has been so successful in using the patient's own immune system that we can now offer hope to those children that we haven't really had anything to offer before.
What is the major difference between this and how you're treating patients at this time?
Well, traditionally, we've used a combination of chemotherapy and bone marrow transplant to cure leukemia, and both of those are associated with significant side effects and toxicities. What CAR-T does is actually uses the patient's own immune system cells, or the T cells, and we can filter those cells from the patient, kind of like a blood donation, and then in a test tube or in a lab, teach those T cells how to recognize the leukemia specifically. So when we give them back to the patient, instead of just looking for any kind of cell that needs to be destroyed, they hone in specifically on the patient's leukemia cells and targets them specifically. And then they can, once they get connected to those cells, then they can destroy them using their own normal immune system mechanisms. So it's not giving the patient anything that's a chemical or a toxicity that can cause long-term side effects. The other really exciting thing about this is that once those cells learn how to recognize the leukemia, they can stay in the patient for years and years and sort of serve as a patrol to keep the leukemia away, and that allows the patient not to require any other therapies. So when it works, it's truly incredible and miraculous almost.
The FDA approval of gene therapy to treat leukemia just approved the other day. Is it too early to get a handle on who might be receiving this, who can receive it? Can it be widely used at this time? And what about the cost factors involved?
So this research has been going on for a few years in a very small number of institutions, and has been quite experimental up to now. So it was not available to most patients. However, we certainly tried to get our patients to these centers when we have no other effective therapy. In the future, however, with the FDA approval, I think it will become more widely available, and more centers will be able to either develop their own programs or even eventually have this technique of teaching the patient's own T cells how to fight their cancer available on a commercial basis. I know in the next probably 5 to 10 years, collection of T cells for patients with high-risk leukemia will become fairly standard, and our hope is that we will know from the beginning if a patient has a high risk of not responding to traditional treatments, if they would need this, and we would be prepared from the very beginning to be able to offer that if it comes to that. It's not cheap. However, the prices are comparable, I think, to bone marrow transplants, and certainly, for the years of life saved, it's certainly no greater cost burden. So I think it helps for those of us who've been practicing for a long time. It's really a wonderful thing to know that more patients hopefully can be cured with this treatment that we've never seen before.
Well, it certainly sounds encouraging and very promising for the treatment of those afflicted in the future. Dr. Katharina Elliott, Medical Director, Bronson Pediatric Hematology and Oncology. I appreciate you joining us this morning on WKZO to share your thoughts on this important development in the medical world. Thank you so much.
Thank you for having me.
Our pleasure. On News Radio 590 and 106.9 FM, WKZO.